Hi, Dr. Gutierrez. Thank you so much for taking the opportunity to meet with me this morning. I just had a couple of quick questions for you. I just would like to get to know you a little bit better. Could you tell me a little bit about yourself?
Yes, I want to tell you my background. I migrated from Mexico into Sacramento, and being a poor family, my parents were migrant workers, and we had not that much money for the dental needs that we had, and we suffer from dental infections that I had to go see a dentist. In my benefit, I got a really good dentist that took the time and take care of me to my needs. Mm-hmm. So poor guy, I was asking so much questions, but because of him, I got into dentistry.
I see.
And I had a really good experience.
Well, good. You had mentioned when you were a small child having dental needs. Do you accept children?
Yes, actually, I want to provide the best care and actually more of the experience, because care any dentist can do, but the good experience, not a lot of dentists know how to take care of kids. Nice. And I inspire by providing that to them. And so when they grow up, they have the best experience at the dentist.
Right. Now, Dr. Gutierrez, I do have two small children, and they both unfortunately have dental anxiety. How would you go about treating them?
Well, kids is really difficult because most of the time, if they're not cooperative, the alternative is to take them to the hospital. Well, a lot of times we have to give the body to take care of itself. Mm-hmm. So we have to take care of the person, not the infection first. So providing the best experience, then the patient tends to cooperate, and then you can treat the infection. Unless there's an infection that is acute that you need to address it, infections, abscesses, right, that can be lethal, then we have to address them. But most of the cases, I can treat the patient first and then the infection.
I like that because my two little ones, like I said, do have very high dental anxiety. So I like the way that you would go about doing that and relate to them first and get them to feel comfortable before moving on to treating.
It's amazing with nitrous, you can do a lot with kids. Mm-hmm. There is some cases that you can't treat, so you have to send to a specialist to take them to the hospital or do sedation in the office, which it could be dangerous, and that's one of the reasons I would like to avoid it if it's possible. And my kids and anybody else's kids.
Yes. Oh, thank you. Just one last thing. I was kind of interested in sleep apnea. My partner snores quite a bit, and so I was wondering how that relates to dentistry.
So sleep apnea is a problem. A lot of people don't even know that they have it. But just because you snore doesn't mean you have sleep apnea. Snoring is just constriction of the airway. The problem with that is sometimes you've constricted enough that your airway is blocked, and then you stop breathing for a couple of seconds.
Oh, yes.
But that can go multiple times in an hour. Depending on how severe it is, it can go all the way to 60 times in an hour, which is a lot. So therefore, it affects the whole body, not just the sleep. It affects the heart, and actually 50% of the population that have heart attacks, it could be related to the sleep, the snoring and the sleep apnea.
Oh, really? I wasn't aware of that. So sleep apnea is something that you do treat?
We treat, we can't diagnose it ourselves, so we have to get a physician that's specialized in sleep. And once we get the diagnosis, then we can treat. There is options out there medically and dental. Mm-hmm. We provide the dental device.
Oh, wonderful.
As an option.
Wonderful. Well, thank you so much for meeting with me, Dr. Gutierrez. I would like to schedule some appointments for my family.
Oh, thank you.